Infrastructure of an Informatics Department by Bruna and Penny. During this presentation, we'll give a brief introduction and define some important terminologies and concepts. We'll discuss technology versus paper, talk about some components of health information system and how they are impacted by informatics to support and enhance healthcare, and a brief introduction. Well, we'll start with some important definitions and important concepts of standardized terminology so you can better understand the content of this presentation. Infrastructure. Infrastructure is defined as the components of information technology including computer hardware, software, network, and peripheral devices such as keyboard and a mouse that are used to connect and send signals to computer and users. In other words, it is the bridging between healthcare and technology while enhancing worldwide communication standards. Informatics. Informatics is the theory, science, and practice of the use of computer and information technology to retrieve, store, transmit, and manipulate data. In other words, it is the science and art of turning data into information. Information. As we have learned from our lectures, we know good information is essential for caring for patients and how accurate information is important to prevent medical errors. The importance of standardized terminology is a crucial part of a good infrastructure. Healthcare terminology standards are designed to allow and support interoperability among healthcare systems with the purpose of sharing information. This has resulted in better communication with interdisciplinary teams, increased the understanding of nursing interventions, and enhanced data collection for patients' outcome. Meaningful use is electronic health information that use information in a meaningful way. It is a piece of a broader information technology infrastructure needed to reform the healthcare system and improve healthcare quality and efficiency. One of the primary criteria identified for meaningful use is the use of standardized terminologies that we just talked about. The main goal of meaningful use is to exchange clinical structured data in a way that is complete and accurate in order to improve patient care and safety in a cost-efficient way. Medical informatics. Medical informatics is the application of informatics and processing to all aspects of medical knowledge, practice, and management, including research and education. Medical informatics focus primarily upon information technologies that involve patient care and medical decisions, which is facilitated by computer technology. What is the difference between the registered nurse and an informatics nurse? The informatics nurse is not only knowledgeable about the patient care as the registered nurse, but has technology training as well. They provide a valuable communication link between healthcare and technology professionals. They can work as consultants in hospitals and with software vendors or web content providers, as well as for the government agencies that focus on disease management. We also have the nurse informatics specialist. The nurse informatics specialist has advanced graduate education in nurse informatics or related field. They usually have PhDs and a lot of experience, and they may hold the ANCC certification. They transform data into information and information into knowledge. When working in a healthcare facility, they may be involved in evaluating and selecting the technology, designing and delivering training, determining end-user requirements, and customizing functionality. Technology versus paper. Now that the EMRs are widely increased in use, its effectiveness is being measured in research. It's agreed that the number one reason of push from paper to computerized technology is for patient protection and safety. Research has shown that technology over paper is safer, more efficient, provides better quality care for patients, and improves research. We'll talk about more of these advantages on the next few slides. Health information system is a group of systems used within a healthcare organization to support and enhance healthcare. There are two types of information systems: clinical, and the administrative. Here on the left, we have some example of clinical information systems, which is the data management system that provides tools to enter data, access information, document, and evaluate care. Here on the right, we have examples of administrative information systems, which is a system that provides tools to support client care by managing financial and demographic information and providing reporting capabilities. For example, administration can look at cost analysis and find trends, which can be very valuable to decrease costs. We'll talk about each of those clinical information systems in more details on the next few slides. Well, I'll briefly talk about how each of these departments are affected by informatics. This model demonstrates how informatics technology affects each department and helps them achieve safer patient care, which improves patient outcomes in a cost-effective way. First, the patients. Like we have mentioned before, one of the biggest impacts of informatics is the improvement of patient safety. Once they're diagnosed, patients can access information about their disease on the computer right away and educate themselves about that diagnosis. Also, some clients have access to monitoring devices that can be used everywhere. For example, they can check their blood glucose, heart rhythm, and even EKG streak wherever they are. And data from that device can be uploaded quickly and electronically sent to their physicians from that location. Nurses. Nursing information systems support the use and documentation of nursing process and activities. It helps to keep the nurse on track and can serve as a reminder. For example, the system alerts the nurse that it's time to get a lab specimen or times to get vital signs. It also reminds the nurse about documentation to ensure comprehensive charting. In addition, it supports a nurse to practice through improved access to information and tools. For example, the nurse can look it up in the computer information about drug interactions and hospital policies and procedures. Physicians. The computerized physician order will improve safety for several reasons. It's more legible and easy to understand than handwritten transcription. The software can be programmed to check for accuracy and completeness of the order. And physicians' orders are directly transmitted to the appropriate areas, such as pharmacy, lab, radiology, which will speed up implementation of the order and increase staff productivity. Labs. The laboratory information systems can also provide many benefits like quicker results. For example, the iStat can check the patient's blood gases, chemistry, lactates, electrolytes, and several other labs in a few seconds at the bedside. Also, it decreases probability of human error. It also decreases probability of human error. For example, it can generate labels with patient information like name, medical record number, and the nurse can either double check with the patient's armband or can just scan both using barcoding technology. That's already available. Lab systems can also provide alerts and let the doctors know when iStat lab's ready or if the result's critical, so they can quickly provide an intervention. Pharmacy systems can provide checkpoints at each phase of medication ordering and administration process using medication-based selection and dosaging guidelines. It can also provide safety and decrease med errors in several ways. They do clinical checks, including allergies checking. The system can also do dosage errors and printing needs, where some pharmacy systems can generate several reports like medication administration history. Radiology. Radiology systems can also provide safety of patient care and eliminates time-consuming and costly scheduling. It can generate patients in structure and preparation procedures. For example, If the patient is claustrophobic or have any metal foreign body related to previous procedures, the nurse can put that on the system. So when the radiologist reviews the form on the system, they can quickly determine if the patient is appropriate for the procedure or not. Also, radiology systems are now using digital images instead of traditional radiology films, which can reduce expenses with X-ray storage. How does that impact the patient? Well, since the system allows the physicians to see on the computer screen just a few seconds after the procedure is done, they can make decisions quicker and improve patients' outcome, especially in high acuity areas such as ER and ICU, where immediate availability of images are critical to provide the ideal client care. During this presentation, we talked about infrastructure of an informatics department. Some definitions and important concepts were described for a better understanding. We talked about technology versus paper and how some components of health information systems are impacted by informatics. Feel free to leave any questions or comments. We'll try to respond as quickly as you can. And thanks for watching this video.